have vascular disease elsewhere, you're more likely to develop glaucoma. So there's a greater risk of developing glaucoma if you're diabetic. That's the point I was trying to make. So they're all interrelated. All of these. Guess what? You know, if I look at a patient who has high blood pressure, you know what their eye look like? Just like the diabetic. It looks almost identical. You can't tell the difference. You know, I can tell the difference, but most people can't tell the difference just looking at a picture. So that's why both those diseases, and I think we tend to undertreat hypertension a lot in our populations. So lots of patients walk around, you know, they'll come to the doctor's office and their blood pressure was 190 over 110, and they all tell me, oh, it's this white coat. I get that way all the time. Well, you might have a white coat, but that's a crazy white coat. I mean, everyone's like, you know, it's like head explosion white coat. You shouldn't do that. You shouldn't have that kind of fluctuation from home to here. So I usually tell them, go see your medical doctor, check it at home. You're going to have that evaluated.
Yeah, Bobby, I was just going to ask about diabetes versus hypertension and high lipid levels. Do they all have fairly equal contribution, or is one more worse than the other?
I don't look at it as that way necessarily, because the severities can kind of change, but they all are additive. I don't know that you can put a number on it. But if you were to, I mean, in terms of microvasculopathy causes, high blood pressure and diabetes together probably more than the high lipid levels. High lipid levels will affect the larger vessels more prominently, and that can result in other problems like vascular occlusions and things that can occur in the retina. So that's why I mentioned those. It's just intimately tied into the metabolic complex of things that we want to try to treat.
A layman question. So does screen time cause retinopathy?
What? I'm sorry.
Does screen time cause retinopathy?
Called brain. I can tell you, my brain is deteriorating. Good question. There's you know, screen fatigue and things like that. Most of us who work, right, even me, and even the doctors, we are just looking at the screen. I keep joking with my patients. Let me look at you. I'm looking at the screen. You're not looking at me, doctor. Yeah, I'm looking at you. So it's just such a ridiculous time that we live in, that we rely on these, you know, these screens that we look at all the time, right? But fatigue is the only thing that probably happens. We don't know of any actual physical damage that happens in the cornea, lens, etc. Two things, though, for children. We do know that with excessive amount of screen time and excessive amounts of reading. If you go to India, go to Japan, what are they doing all the time? The kids are studying. They don't spend any time playing outside. So what happens? They all become myopic and very nearsighted. And being very nearsighted, the globes become larger, and they're at much higher risk for developing severe retinal problems. They can develop retinal detachments. They can have myopic degeneration. These are all really bad conditions. Equally as bad as we don't give them as much credence. But we have lots of data to show that screen time is associated, especially in children when they're growing, with myopia and nearsightedness. So encourage less screen time if you can. It's really important.
All right, any other questions? So what I want to do is that I know like we are a little bit past 3 o'clock, or end time was 3 o'clock, but great questions though. I know like we all learned a lot about diabetes, at least I did. So I know you might have a lot of questions. So what I want to do is that maybe we can kind of time box for next 10 minutes. One question per person. Priya, yeah. Dr. Dhananjay, is that okay?
No problem.
Is that okay, Bobby?
Yeah.
All right. So with that being said, before people disperse, if you don't have any questions, I want to take a moment to say thank you to all these great doctors here, right? So, and Sarita ji as well. So like Sarita ji, like we have been talking for 3 months about this topic, trying to assemble these doctors, trying to come up with like content. You know, all the doctors played, and plus Sarita ji played an immense role to come up with this content. I'm sure, like, I mean, a lot of people are going to appreciate it, like we're recording as well. Eventually we'll get it into our website. But I just want to say, like, again, thank you one more time, Sarita ji, Priya, Dr. Dhananjay, and Dr. Bobby, and also Dr. Goyal as well, who have kind of been doing tremendous favor to our Indian community here, right? So with that being said, like we're going to bring in more these types of events and programs. Hopefully, like that will kind of help people to be more aware. Like some of the things look scary, but I guess the one thing though is that like I'm sure like these doctors, I can speak for these doctors, they're not looking for your applause. They most likely would be more kind of be thankful like if you can follow what they said, right? Like be right on the diet, kind of control your sugar and then your blood your blood pressure, being active, play for some time or do some active exercises. So with that said, I want to turn it over to the questions. Again, thank you so much, doctors and Saritaji. Thank you so much.
I'll be most happy if you don't ever show up in my office.
I agree with you. Anyone have questions?
Do I really need this? I think I do.
I
I have a question for Dr. Dhananjay. It's related to the. So I am aware that kidney patients have issues with the kidneys and heart at some point.
Yes.
But is there any symptoms that a kidney patient can really see and feel related to the if they have a kidney problem inside without going for the blood test?
Very good question. Now, kidney disease is one of those things which is again silent killer. It will, unless you monitor it, you will find it out at the very, very end, okay? You will not have symptoms of kidney failure till you reach approximately around 15% kidney function. Normal is 100%, okay? So unless you check it, you won't be able to monitor those levels, and then the symptoms which will occur will be all systemic symptoms: nausea, vomiting, diarrhea, chest pains, trouble with breathing, swelling of your legs, okay? You can have very bad appetite, you don't feel like eating at all, you have a bad metallic taste in the mouth. And these are the symptoms which occur at the very fag end. And at that time, as Dr. Murthy said, I'm going to use that example, you're in that Boeing, which is flying at 500 feet right away before crashing. Okay, no, you don't want to be in that situation. That's why those periodic examinations, blood tests, whatever your MDs, or whoever physicians you see, nowadays there are advanced practitioners also, some people see nurse practitioners and everybody. But at least if we can follow those, simple things, I think that will be something important to monitor rather than just saying, oh, I don't want to do blood tests. I don't think that's the right way to think about it.
Can I take a crack at this?
Please.
Because I see this all the time.
Yes.
So oftentimes people think that just doing a blood test is enough, and by the time they've come to us, they already have kidney disease that they never knew they had. So it is very, very important to make sure that you look for protein spilling in the urine, particularly microalbumin. Albumin is the smallest protein that you have in your body, and we are talking about microalbumin. So, looking for microalbumin spilling in the urine is a very, very simple and easy test to do once a year, at least, if you're diabetic. And if you have that, then you know that that is an independent risk factor for heart disease. So you really need to get your doctor to make sure you get that urine test done. The blood test will show whether your kidney clearance is low, and that can be related to other factors, like if you're dehydrated, then you can have falsely low kidney function. But you need both these tests. You need a blood test and a urine test. Okay.
So these tests are once in a year?
Usually it's once a year, but just like, Dr. Murthy said, like if he finds there is retinopathy, then he will do it more often. Similarly, there are clear guidelines on how many times you do based on how bad your disease is. Another observation I have is if you have one vascular complication, you should be on the lookout for other vascular complications. So if you have, people who have kidney disease often have eye disease as well. These are small vessel diseases. But if you have disease in your small vessels, shouldn't you be thinking whether you have disease in your bigger vessels as well? So, every hospital has these $50 cardiac scans, right? Heart scans. You should be getting them. They are a very good way to look at calcification in your blood vessels in your large arteries. And if you really have calcification in your large arteries, do you really think that there are none in the brain? Do you think that your body is only going to attack a blood vessel in one area and spare the other areas when blood runs everywhere? So think about that. Think about, your body as a unified whole. And so if there is a disease like bad diabetes, it is going to affect all of your body. You just don't know it now, you know.
My question is in the continuation of this. Like, that is the biggest problem. Whenever we go to the doctor, usually we go for the lipid profile or just the normal blood test. We actually don't know what are the tests we really need on a regular basis, like once in a year, like some scan of the heart or the test that you say, okay, for the test that can be done through the blood samples, those are okay in lipid profile or the urine test. But what are the other scans or like other things that we should ask our doctor? Usually they don't ask us to do because that is going to increase our medical charges, but
Nope, that's not true. Medical charges are not, most doctors we have guidelines for everything, sorry.
I completely agree with you. This is exactly the point.
There are guidelines for everything. In America, we live by these guidelines so that we can benefit, we can do the greatest good, you know. So these guidelines are not made arbitrarily. You are trying to choose the blood tests and the urine tests that you can do at the most reasonable rate financially to affect the maximum population. You know, that's how guidelines are, you know. So if you are diabetic, your doctor will tell you to get a lipid profile, to get a liver and kidney function, to get a urine test, and to do yearly eye exams. This is every diabetic, it's standard for every diabetic. And then based on what they see, they will do, you know, more blood tests. I have never seen under blood testing, I have seen over blood testing. So, but urine test they sometimes miss that, and eye exams.
I do have one question about Sarita ji. I've heard something about that where, like, if you refrigerate the rice, it'll break the starch resistant, and then, like, I mean, you know, that will, you know, after you consume it, like, it's not going to spike up your sugar. Is that true? Refrigerate the rice and then reheat it and then eat it.
So let me ask you one thing. If you just eat from one side of the mouth, you'll absorb less.
I've been told about it. I just want to ask.
Nothing like that.
Nothing like that?
No. There was a practice in India that you would take out the starch from rice. You know, that you might as well eat grass. You know? So, but there is amount of rice that you eat that is important. Not that if you refrigerate it or it will break it down in some way and then you eat it, it will be less effective. Amount, mark the portion size.
Thank you.
We do eat frozen foods and we freeze the food and we keep it in the refrigerator, all good and said, you know, but in our practice, after 4 hours, food is not really that good. There are vitamins and minerals that are lost. You're taking that chance, and then you want to take a pill at the end of the day to cover for all those losses. That works, but not quite effectively.
Can you elaborate a little bit on the apple cider vinegar supposed to help with weight loss?
There is just so many things going on that, you know, that I'm not too fond of all those things, just to say the least. There is no one magic way that you will lose weight and your blood sugar will be fine and your blood pressure will go away and you will wake up and drink just apple cider vinegar. No. There is no one magic way to do it. And at the same time, all these lifestyle changes will help control blood sugars, blood pressure, everything. It's not going to make you immortal. You know, ajar amar koi bhi nahi hai. The body is nashwar. Eventually, everybody will go one way or another. But you can make it better. You don't have to just add on to the problems. Diabetes is one thing which you do not feel. कि आज दर्द नहीं हो रहा, आज उठ नहीं पा रहे, ये नहीं हो रहा, कुछ नहीं होता. It's a silent killer. inside it is getting to all your organs. So keeping that blood sugar in control, what happens usually is that you are aging, but your mind is still like you were a teenager and you're eating like a teenager or a 20-year-old. You have to modify your lifestyle. You have to think what your requirements are. You're not walking that much. You're not lifting weights that you should be eating all that. So what happens is when you overeat, you overdo on calories. So end of the day, body will store that as fat. 1 gram of fat stores 9 calories. 1 gram of carbohydrate stores 4 calories. So you keep on eating extra, eating extra, kahan jayega? Kahin to body will store, So, and we are not starving, especially in this country. I have yet to see that, oh my God, khana hi nahi mil raha. We are overeating. So we have to slow down, keep everything in perspective. Write down what you are doing, how much you are eating, Keep that in mind. So fresh food will be the best. A lot of us do practice that we cook fresh every day. I don't usually say that I go home and cook every day at work, because there is nothing better in your life than to just go home and cook. Well, that's the lifestyle choice I have made. And it's really, in long run, it's physically, mentally, spiritually comes out much better. Eating dinner, eating one meal with family makes a big difference. Eating by yourself, we are all social people. So eating and enjoying your meal with your family, make it a point you do that. Relaxing, no phone time at that time, no TV time. Sit down and relax and have a meal, enjoy your meal. It doesn't have to be on the go, on the rush. Oh my God, I'm late for this, I'm late for this, I'm this. Oh, let's just have whatever. No, plan it. It's an investment. Everybody, in our community is well-to-do. If you ask somebody, I am doing this for my retirement. Well, you have to live to see your retirement, So how come you're not even thinking about your health as to how you will be, 20 years from now? And you don't want to pay attention to that. We have adapted some bad habits coming to this country, if you maintain basic healthy diet, you will have to come back to those food groups. Dal, chawal, roti, sabzi, dahi. That's what we started eating when we were kids. That's what our mom offered. Mom didn't ask, beta, aaj tum kya khaoge? It was given. This is the meal time, you eat. It's not like food is available in abundance. There was a patient I saw, the husband said, because we came from another country, so food was very expensive. Now the food is very reasonable. So my wife just cooks and we throw parties, and here she is. She actually needed kidney transplant. I used to go for interpretation. And she said, no, I don't eat. And the husband is telling me a different story. So keep everything in perspective.
All right.
Sorry.
Yeah, with that said, we're going to wrap up and give a little bit of a breathing room for all the participants from HTCI here. So, if you do have any questions, you can email the questions to HTCI@htci.clinic@htci.org. So that email address is on our website. So feel free to look up, and then those questions goes to Dr. Goyal, and then Dr. Goyal can circulate with the other doctors and Sarita ji, and then they can get you those questions answered. So with that, thank you all so much for coming over here and participating. Very much appreciated. One other last request, if you could also fold the chairs and hang it over there, that would be great. Thank you. Again, thank you Sarita ji, Priya, and Dr. Janardhan. Thank you so much.
Thank you, HTCI.